Law and Medicine, PACES tutorial, Focus Clinical Problem, Station 5. The purpose of this presentation is to explain what Station 5 is about. It is helpful for any candidate approaching the exam to have at the back of their mind what this station is supposed to test. It is simply for consultants to know what holders of the MRCP diploma can get to the root of a clinical problem even when working under the pressure of a busy clinical service. Examiners have to agree what they agree on to pass a candidate. Therefore, it is very much worth spending a little time studying the calibration sheet and marking sheet available on the MRCP website. From this, we have drawn up a simple list of tips to follow. The presentation will conclude with an example of a scenario typical of the type that make up the bank of questions. It is hoped that this will give you a flavour of what to expect. The best way to get good at this station is to practice. To conclude, we will offer you practical tips how. Station 5 comes after Station 4 and before Station 1. Here is its precise position in the PACES carousel. The Integrated Clinical Assessment Station aims to assess the way in which the candidate approaches a clinical problem in an integrated manner, using history taking, examination, and communication with a patient or a surrogate patient. Other features are as follows. Written instructions for each of the two cases, usually in the form of short notes or referral letters, are given to the candidate during the 5-minute interval before this station. The two examiners are present throughout. For each case, 8 minutes are given with each patient to take a focused history, carry out a relevant examination, and respond to the patient's concerns. 2 minutes are for describing the positive physical findings and to give your preferred diagnosis and any differential diagnosis after the patient has left the station. The purpose of this station is simply to test a candidate's ability to focus on a short clinical problem. The candidate is still supposed to communicate effectively with the candidate. It is conducted in a highly structured manner. The marking scheme is also very predictable and must be complied with. The station is supposed to simulate a real-life situation. This could be on a ward or in a busy A&E department, for example. There is a room with the candidate, the patient, who could be real or an actor, the pair of examiners. The candidate is, from what it seems, actually encouraged to perform his or her history and examination simultaneously. Anyhow, the RCP has offered guidance on a minimum standard for a candidate to pass this station. Marks in the old Station 5 were very high and showed little variance. This station is intended to be a better discriminator of clinical skills. The candidate should elicit history relevant to the complaint and always appear focused, fluent, and professional. The examination should be likewise. Correct signs should be offered. No incorrect signs should be found. The candidate should propose appropriate investigations, problem list, and management plan. All the time, the examiners will have an eagle eye over the candidate's ability to ensure the patient's comfort, safety, and dignity, and dealing with the patient with due sensitivity. Your role. You are the medical doctor and asked to see a surgical patient undergoing an elective colonic resection. Patient name, Mrs. Jill Morell, aged 55 years. This 55-year-old lady complains of tingling in her arms. Your task is to assess the patient's problems and address any questions or concerns raised by the patient. The website consists of various scenarios. These contain information for the candidate, the mock patient, and the examiners. There is also a link to the marking scheme. You don't need to go on expensive courses, just get a feel for the station by practicing with friends. It'll be fun.